So I'm really happy to welcome you all to the third ATF-Talk, the ATF-Talk of March. This time I have the pleasure not to interview just one person, as you have seen from the invitation, but I have 5 experts from the industry. We are going to talk about the MDR compliance. What impact will the new regulations have to our sector, the assistive technology sector? And what is the role of all the different stakeholders on the market? I would like to start from you, Paul. You represent the manufacturer here in our panel discussion.
Been a huge investment, both in time and money, but we feel as though it's worthwhile.
When did you start?
We started approximately now about 18 months ago to work through all our products. The MDR in Europe was the first step, but we can see it being replicated elsewhere across the globe. So yeah, we've really embraced it and ran with it as quickly as we can.
Paul Roden, you are quality assurance and regulatory affairs specialist. This sounds excellent. Tell us a little bit, what does it mean and what is your role?
To ensure consistency of safe and effective devices. We now have the MDR, which is the medical device regulation.
Right.
Yeah. So the biggest difference is the directive can be adopted in different countries, determined by what they wanted to take or not take. With the regulation, it has to be imposed into law in each country of the EU, word for word. So it is a law, it's a regulation.
There is also the software side, and this brings me to the next expert, to Jeff McBride. From our conversation, you explained me that you're doing more or less the same as Paul, but you are an expert on e-health and software.
The biggest difference between software and hardware, it's usually very obvious when a piece of hardware is a medical device. It can be a little bit more difficult to decide whether a piece of software is a medical device. But once it's established as a medical device, there is a challenge for the industry to meet the requirements of the MDR.
Nadine, you are in the role of an importer distributor for Europe. Which role do you play in this chain?
Okay, so our responsibility, first and foremost, that I'm looking at, is basically ensuring that the goods we purchase from a whole range of manufacturers, if they need to be classified as a medical device, that we have the correct documentation to show that they have been classified as such by the manufacturer.
Finally, it's the manufacturer's job to make the product ready for the European market.
Yes, yeah.
The next one on the chain, then finally, who is bringing the products to the customer? Jürgen, finally, you need just to scout the products which are fulfilling the compliance. So you have the most easiest job of everybody here.
Well, at least for Germany, we have, as a supplier, we have had quite some changes on our risk management. As we judge the MDR, we have now to check if they have fulfilled everything the MDR requires. So if we can't prove that our quality management does make sure that we checked all the MDR requirements, we could be as well sued for not doing that as a manufacturer would.
Who is financing this workload?
So it's a margin shrinking process at the moment, and I don't know if we will be able to transfer that to the insurance system one day.
What happens if a company continues to sell products which are not fulfilling the restrictions from May?
The bottom line is 26th of May this year, any organisation that sells medical devices into the EU should have registered with the EUDAMED database as either a manufacturer, a distributor, an importer, or an EC rep. And if they haven't, and a device is sold into the EU, unknowingly it gets in and somebody is injured or hurt, the consequences that can be criminal, not just civil.
as a reseller, do we need to track also all goods by UDI number along the chain? So it means until the end customer.
We will track this number for every product.
So even for a switch, you're going to track them by
Yes.
Okay.
But at the moment, you have to judge, is that a risk you take or is that something you don't have to do? And we have judged that we should do that.
One of the other things that Stefan asked a little bit more in depth, you have to do different things if you're an importer or a distributor. So you need to sort of decide what you are. So for example, Sonomi in France, I would class as an importer, where RedNet is a distributor. So an importer is basically selling products to end users where a distributor isn't. And as an importer and a distributor, you need to do different things and you need to have different things in place as well. So companies need to decide what they are.
Just to say, yeah, it's a really good point, Paul, because, and for inclusive, we're sort of in both camps. So that's where it gets, potentially more complicated. So we actually manufacture software, we distribute hardware, but we also sell to end users.
Is it a medical device? Is it an accessory to a medical device? Or is it a component? Any accessory that is crucial to help a medical device fulfill its designated purpose, then the other product becomes an accessory to a medical device and must fulfill exactly the same rules as a medical device itself.
And my question would be, it's clear that the software itself is a medical device because it's compensating a disability. But when this medical device software is paired or mounted on a standard tablet or phone and sold as a complete solution to the customer, is the hardware then also a medical device? Or how would you declare this combination of medical product and not medical product?
The software is the medical device, not the hardware. Where Jim's got the difficulties, if the software has to be loaded onto a specific medical device and on a specific device, and then that device is distributed, that does blur the line, because you need to keep a track of both the software and the device.
If I take an iPad, I download an app which is fulfilling the restrictions. Is then my communication solution as complete product solution fulfilling then the restrictions?
When you combine an iPad with a software solution to support the end user, even though the iPad is an Apple mainstream device, you're effectively classifying the combination of those two as a medical device as a manufacturer.
Exactly.
Yeah.
But that means you need to be allowed to classify products.
Exactly.
And this is something you need to apply specific and as a company in Germany.
Yep.
It's a costly process we have to go through to hopefully reap the benefit long term, is the way I see it.
I would view it as in, it's giving you guys, it's giving the importers, it's giving the distributors and the manufacturers a sense of security. The EU is trying to protect the consumers. And as a manufacturer, distributor, importers, we're saying, yes, we still want to be involved in that market, so we are going to comply. As Paul Anthony said, yes, there is a cost. There's a cost to everybody in this chain. It's lifted the quality of assistive technology products available on the market higher. That is what I hope we look back on and say.
So yeah, in 2 years' time, I'd like us to be able to look back and say, okay, it was difficult to impose, but it has genuinely brought benefit.
I hope in 2 years we all sit together live and have a wine or a beer together and laugh and sing about these times we're just experiencing.
I think ultimately we all want the same end goal, and that is to abide by the law and make sure that we're fully understanding our obligations. But I hope in 2 years, yes, that we will all be sat in the same bar, sharing a drink and saying, yeah, great, we're through it, everything's sorted, everything's progressing as we want it to.
Thanks to everybody who made this talk so interesting, and a really special thanks to all my guests. Thank you so much to join the talk, and stay safe. Bye-bye and goodbye.